Hi everybody, I'm Mark Miller with Health Strategies and I'm your value-based educator. Thank you for watching this video on how to increase your value-based payments without paying a lot of expensive consulting fees. We all know that hospitals and physicians are experiencing increasing complexity in these value-based payment reimbursement programs. Many of these programs have differing goals, differing metrics, mechanisms, and these have now expanded across all of the healthcare segments. For example, the commercial market, Medicare Advantage, large self-insured employers, Medicare Standard, and Medicaid Standard. So I know that many of you are frustrated that you're not able to receive additional payments for your value-based contracting, and you're busy with your own responsibilities and you're just not able to get to the bottom of it. These are contracts that you're already participating in. And in the meantime, the large, expensive healthcare consultants are just not something that you think that you can afford. The good news is you have an alternative to the big companies wanting to charge you some expensive consulting fees over many work streams, many phases, and over a long period of time. That alternative is the educator model. An educator is a coach, a counselor, and someone who's willing to help you on an hourly basis just to help you get enough education that you need in order to support your needs and no more. So I have a personal example of what we want to avoid in terms of paying these big expensive consulting fees. When I was senior vice president of a large health system, I had to pay $512,000 for a multi-year contract, which started out as just setting up my value-based contracts. But at the end of this phase one, I learned that implementation of these contracts and negotiations with the payers was not included in phase one. And then after phase one, I had to go ahead and commit to the implementation phase, which was phase two. And this included negotiating with the payers on these value-based payments. I signed the phase two engagement for over a year's period of time, and at the end of that, it was recommended again by the consulting firm that we go on to phase three of the engagement, which was operationalizing and managing the value-based payment models and the contracts that we had negotiated with the payers. So there you have it, a grand total of $512,000 for a multi-year project that began as just a contract payments review. This is what you want to avoid. So do yourself a favor and look at the educator model, and it might be a better fit for your budget. Well, that's it for this episode on increasing your value-based payments without paying for expensive consulting fees. Let me know what you think by commenting on the comments section below. If you enjoyed this video, please share this with other providers who might need help, and give it a thumbs up below as well. That really helps more people see this video. And of course, if you like the educational approach, if you have any questions, and you want me to help you cut through the BS of the value-based payments world, I'm happy to help you with that. Just get a hold of me on my cell phone at 615-335-0503, or you can email me at mm.healthstrategies@outlook.com.